Now, the latest on vaccine news. By now, you've probably seen the pictures. Frontline workers across the country beginning to receive the COVID-19 vaccine, but not yet in Kern County. As 17th Eton Wallace reports, local medical leaders are speaking about when they expect that vaccine to arrive.
We are anticipating that vaccine.
Right now, it's a waiting game. The first shipment of roughly 5,800 Pfizer vaccines have not yet arrived in Kern County. Across the country and California, frontline workers already have received the first shot, but not so in Kern.
All of the hospitals in our county are still waiting for that because that is going to bring this closer to an end for all of us.
During a virtual COVID update, Dr. Hemel Kothri of Dignity Health said the California Department of Public Health anticipates it could be at least another day until the vaccines arrive.
We're hoping we'll get it tomorrow, if not by Friday. And as soon as we get it, we are going to start vaccinating our population that are at highest risk.
For the second straight day, TV17 reached out to the California Department of Public Health to ask why the vaccines have not yet arrived. As of this afternoon, the department was working to provide a statement. This as Kern hospitals are filling up.
So we're seeing that spike. As far as the ICUs are concerned, we all, in this case is for all hospitals in Kern County, continue to see an increase in patients over the last week or so.
Last week, Memorial averaged roughly 48 new patients per day, but this week, that figure is closer to 70. At Mercy, the hospital is treating 72 positive patients, and another 200 are believed to have the virus. The hospital is now out of ICU beds. Currently treating 32 ICU-level patients, the hospital has 28 ICU beds. 4 ICU-level patients are receiving care in the emergency departments at Mercy and Southwest.
The number of patients that we're seeing right now are actually just a little bit more than what we saw in the July-August timeframe. The thing that concerns us is the steepness of the curve is dramatically more than in the July timeframe.
Now, Dignity Health leaders say they are set to enact a plan to voluntarily test employees on a weekly basis. And as for that COVID vaccine, well, we will let you know as soon as it arrives. In Bakersfield, Eton Wallace, 17 News.
Meantime, more vaccines are arriving today in communities across the country, and those areas could receive a second injection of vaccines within days. An FDA advisory panel will meet tomorrow to review Moderna's vaccine candidate. Clinical trials show it is as effective as Pfizer's, but it doesn't require sub-zero storage.
Even with the emergence of these new tools, we are not at the finish line yet, especially as we approach the holidays.
Health experts continue to plead with the public to keep wearing masks and avoid celebratory gatherings. The death toll in the U.S. is now above 300,000, and the CDC says it could climb by another 60,000 in the next 2.5 weeks.
And while the Pfizer and Moderna vaccines promise to curb the pandemic in coming months, Kern County residents are still catching this disease in record numbers. 17's Moses Small is in studio now with a look at the daily cases and more. Moses, good evening.
Jim, thank you. There's no sign the surge is slowing down anytime soon as we get closer to Christmas. And now let's take a look at the numbers as the coronavirus continues to surge in Kern County. Public health officials report 987 new cases today and thankfully no new deaths. That means almost 55,000 people have been infected with the virus in Kern County since the pandemic began, and 470 have lost their lives. Now check out this graph here that shows the 7-day average of cases in red and the daily case totals in blue. We're seeing a similar surge as to what we saw in the midsummer, and the trend goes something like this. You will see the spikes here caused by some kind of gathering that could elicit more infections. In this case, it was the 4th of July, so the Monday after the 4th of July, when the health department was able to process those cases, we saw our case total spike, followed very quickly by the 7-day average. And in this case, health professionals predicted that Thanksgiving would produce a very similar response as more Americans travel for that holiday than any other time this year. And so since Thanksgiving, right around this period, our daily case average has more than doubled to around 868 people per day, and 11,664 people have gotten COVID-19 in Kern County since then. And let's shift gears now and focus on hospitalizations, which follow soon after the rise in cases. And over here, you can see a very defined curve approaching the same levels that we saw in the summer. And the difference this time is that health professionals do not predict that this surge is going to stop, especially with Christmas approaching. And right now, 299 people are hospitalized with COVID-19 right now in Kern County. 64 are fighting for their lives in ICUs, represented in red down here. And the reason this concerns health professionals is because, as Eitan Wallace had previously mentioned, when hospitals fill up with COVID-19 patients, they have less ability to look after everyone else. So a rise, an increase in COVID-19 infections and hospitalizations affects far more than COVID patients themselves. And this does concern officials additionally because about 1 out of every 16 Kern County residents has COVID-19 right now. And the most severe cases go to ICUs or intensive care units. So now is the best time during the pandemic to follow these protective guidelines to keep yourself and the community safe. So Jim, I'll send it back to you at the desk.